A new study on breast cancer released today could cause more confusion for women trying to decide if you should get a mammogram. The Radiological Society of North America says women in their 40s would benefit from annual screening. That contradicts the latest Canadian guidelines. They suggest mammographies for those women are of little benefit and can actually lead to needless procedures. We asked our medical specialist, Dr. Karl Kabasele, for his thoughts.
You may have noticed in the last few weeks, there's been a lot of news about breast cancer screening. Recent Canadian guidelines have said that women between the ages of 40 and 49 don't need regular mammograms. But a new study released this week is contradicting that and saying that women between 40 and 49 should be getting regular mammograms. So it can be difficult for a woman to know exactly what to do. Looking first at the new study released this week, the problem is that it hasn't actually been published or peer-reviewed, and the methodology of the study has not been released. So it's difficult for us to pass judgment on that particular study at this time. So let's reserve judgment on that. But looking at the new guidelines, the Canadian Task Force looked at all of the evidence of whether or not mammograms were necessary in the age group of 40 to 49. They found that the harms may outweigh the benefits, but they do recommend that each woman speak to her doctor and come up with an individualized plan as to how often they should get mammograms. So the most important part of the new Canadian guidelines is that they're not prescriptive. They actually call for each woman to talk to her doctor about her individual risk and her values around whether she's willing to take on the potential harms of regular mammograms versus the small benefits for women in the 40 to 49 age group. And so that conversation is something that should be ongoing between each woman and her doctor. I'm Dr. Karl Kabasele for CBC News.